Good morning, everyone. Welcome to IPC Global's Reopening Schools Using Analytics. Today, we will be hearing Mark Mearsman speak to us about how to use analytics. Mark, since the introduction of COVID-19 into the United States, Mark and the IPC Global team have been working with healthcare organizations as well as academic universities to help use analytics for medical research and public policy research to drive an impact to our communities. Additionally, Mark Mearsman has been on a COVID task force team focused on K-12 to help schools reopen. And lastly, Mark Mearsman also has been involved in being a subject matter expert on how to use our analytics and solutions for media outlets. But more importantly, here at IPC Global, as well as Mark Mearsman, are all, like many of you on the call, are parents. Mark's a father of 5 kids, and we all have vested interest in helping our communities be safe and our kids be safe when they go back to school. We hope that you find this webinar insightful and helpful. That being said, one last house cleaning item. If you have questions or inquiries, at the end of the webinar, we'll provide you with some contact information that you can feel free to reach out to us to talk about any questions you have regarding what you saw or any potential educational needs that you need regarding what we're covering. With that, I'll turn it over to Mark Mearsman.
Thank you, Alex. I've been blessed for over the last 20 years to build our firm, IPC Global, focused on leveraging data and analytics, in particular in education. And that means to the benefit of leadership, the teachers, and all that execute in operations, and then certainly the outcomes for the students. And as Alex alluded to, I, along with all of you, really are personally vested in getting this right. And in this case, this means successful reopening in the fall. And we here will demonstrate a number of tools and techniques and best practices in order to achieve a successful reopening and a sustained recovery of that. So I broke the problem down for all in today's conversation into 3 areas: to reveal, reopen, and recover your school system. And so to reveal, we must have a successful strategic plan in place as it relates to the reopening and all of the details associated with the student, with the classroom, with the types of extracurriculars and sports are available, with regard to the transportation, with regards to the food service. And we need to communicate that plan, the reveal of that, to give confidence to our constituents that we are dressed and ready to take on the reopening, recognizing that there are risks in there. And for those known risks, that we have a mitigation plan associated with that. And so coming forward here in July, early August, having that plan ratified, communicating that out, and being ready. Then moving to reopen. That means here again that we are going to do teacher and staff training of our plan. When the students are coming in, we're going to do drills with those students. We are going to ask leadership, directors on up, to govern the plan and have a successful reopening. And lastly, to recover. Recovery at the end of the day is a successful completion of the skills of each of those classes and ultimately to graduation. But we've got a huge setback from the end of last year. So to establish student level benchmarks and understand where they are. And having raised 5 kids, I know some were more resilient than others in recovering. So we can then manage to the exception. I was certainly could see that some could manage back to a level of competency themselves and others could not. So now managing and understanding where those exceptions are and assigning resources to them, and then setting interim targets. So it's not at the end of the year that we're figuring out how we did, but understanding from that watermark how far we've come. So let's start at the beginning in the reveal. And that's where we're going to take a look at a few things that you can do yourself here at the end of this call. And I'll show you that firsthand. But 2 slides to introduce that. To understand what is most vulnerable in your district at a low level of detail. And that means zooming in to all of these dots and focusing in on where vulnerabilities exist, assigning resources and monitoring that, quickly identifying where challenges may exist, risks exist, and then mitigating those risks. So let's take a look at this here. So when you go to IPC-global.com, you'll have that from this webinar. Down here, you'll see this thing for School Focused COVID Tracker. So you're just simply going to launch that. Within here, there's several pieces of information. We're going to zoom in on the school bit. But before I do that, let me simply say that what we haven't done in this site as incorporated the CDC Social Vulnerability Index. Those are low-level analytics metrics around socioeconomic, household, minority, and housing type information, including poverty and no high school diploma, the age of the population, the minority status, and or the types of things like crowded housing. So this type of information integrated with the actual COVID cases happening in your county, in your state, of course, along with overlaying all of the school districts in our nation. So we brought together 3 key pieces of information: the CDC SVI, social vulnerability, the Johns Hopkins data, and your school district data, and we integrated that across the site and then down into the schools. So let's take a look at real quickly just a little bit more on social vulnerability here. Just for my sake, I'm going to go ahead and drill into the state of Georgia. Into the state of Georgia. And in the state of Georgia, we, like all states, have social vulnerabilities, right? Poverty, group housing, minorities. They don't have transportation, vehicles, things of that nature. So what these social vulnerability scores come out to be is information that we can use in order to plan and execute. And it goes down into a reporting level of detail when you go across here. Like if I wanted to get into, various housing types here. And these are the ones that are in the highest percentile of living in mobile homes, or having no vehicles, or living in group quarters. These are things that happen in our states, in our counties, in our census tracts that happens in. So understanding the vulnerabilities, there's several of them, we'll see a few of them today, is worth understanding what they are. And so just by way, you're able to drill into a state and then drill into the counties of that state in order to do that. And so you'll simply, by clicking through this information, you'll be able to see that. But for this call, we're drilling down into schools. So here in schools, I'm going to go ahead and click on my state. You can click on your state, Jersey, Pennsylvania, I see on the call, Georgia, of course, where I live here, and seeing this information. But then drilling down into the county that you live in. So we're going to drill down here into Hall County. You may have seen them on the news as one of our troubled counties with regards to COVID. They are the largest poultry producing location in the world, and have a number of factors associated with that. But what I love about what you're seeing on the map right now is we just drew down from country, county, census tract information into Hall County that we can take a look at this information. And what the dots represent on here are the actual schools in our county. So let's take, and so in here, I've got a number of school types, of course. I've got my high schools that are here. I've got my elementary schools, which are all over, of course, naturally, etc. And so these are the different schools in there and the actual schools types, but these with the highest vulnerabilities. So here, this elementary, this intermediate, this elementary, these numbers that we're seeing here are the highest levels of social vulnerability here. So what we've done now is taken all of the schools that are in there and now narrowed it down to 8 that we might have a conversation about. And what are those conversations that I would like to have? Those conversations are about crowded housing and how we might educate our students and teachers, for that matter, with regards to living in closer quarters, the higher expectations of things, looking out for one another, finding places in which they can create safe places in their home for those that are showing or even testing positive for illness. So these are the types of things, those that we can educate them on engaging the older part of the population, the 65 and over, which are the population, unfortunately, that are most vulnerable to death as it relates to this particular disease. We hear that nearly 50% of those that are living in assisted living are the deaths in our nation. So this is the type of things that we can understand and begin communicating, and always paying attention to. Some of them do not speak English well. So when we talk later on about communication, that we need to be able to understand what languages that we need to be able to get this message out from our schools, and be really sensitive to all of that. So what I'm going to encourage each of y'all to do is, at the end of this call, go ahead and come into IPC Global, drill into our social vulnerability index, and drill down and study this. And we're happy, of course, to help interpret, if need be, some of the information that you'll see on here. There is a ton more of information on this site. We've been on the news a couple times now with regards to the information that is being made public available for free from IPC Global with regards to this. So understanding in the revealing part of this, you need to put your plan together in and around specifics about your district, and hopefully this will help. The next thing I'd like to do is actually move into the type of governance that you're going to have in here. What are your plans for virtual learning, in-person learning, but most restricted because something is going on, or in-person learning, the new normal, least restrictive, potentially based on the guidelines that we'll all adhere to. So let's take a look at what might happen on our campuses. Student tests positive. Do we have a plan in which we can react to that? So in this example right here, I've got a student that tests positive. What is our plan for the class? What is our plan for the clubs? What is our plan for the sports in which that student is? What is the plan for the teacher and coach that taught that student? The faculty in which are in the buildings of that teacher? What is the plan in which we communicate down to the parents in the home that is off our campus, much less out of our control, but nevertheless party to the communication with regards to this? And moreover, what about the sibling who rides in the car or sits on the bus or otherwise with our students? What is the plan for him or her and their class, and their clubs, and their sports? So here's an example of where we may suggest an implementation plan for what happens, and then the ensuing communications as it relates to when a student tests positive. Next one is teacher test positive. Wow, teacher test positive, students, classes that teachers taught, clubs in which those kids are in, sports in which those kids are in, communication out to the parents of those students, siblings of those students. Again, a thoughtful tracing process in which you can easily communicate and less easily, but nevertheless implement with regards to your district. What if a parent tests positive? Well, first off, we are asking for them to participate in the communication, the sharing in the responsibility. We would ask them to communicate to the school and moreover, have their students, their children, excuse me, out of school. From there, the school would respond to things that are in their control, meaning the student and siblings are not allowed on campus for that period of time that is in the guidelines. Secondarily, implementing these higher level restrictions with regards to the teachers and the classes in which they reside. And then the last one, even more so out of our control, is a sibling of our student, but the sibling doesn't go to our school. Sibling doesn't go to our school, parents and students. We would again ask them, as in the last slide, to communicate that that is a fact. We have a positive test, which is the key word, and the fact that we would ask them then to have their student working off-site, and then moving to a higher level of restrictions for the classes and the teachers on our campus. So let's take a look at what that might look like from an information system standpoint. So what we did is, you guys might be familiar, most of the student information systems have an API called the Clever API. There's a few of them that allow easy and effective access to student information systems. So we just went out and loaded a bunch of data from the testing site from Clever. And in there, we were able to load, they had 100 students out there, they had 89 teachers, they had 98 classes out there. And what we did is we enriched this with the clinical information from a district, whereby which Reba Reynolds tested negative on September 15th for COVID. But she was suspect, she was sent home, and she tested negative. However, interestingly, Mark Mueller, who's in her class on the 2nd, tested positive. So let's take a look at that. So now I've got, we're going to take a look at Mark. Wow, Mark Mueller, he's taught by teacher Rupert, and Rupert teaches 2 classes in which Mark is in. All right, well, let's take a look at, so we're looking at 1 student, 1 teacher, 2 classes of the entire school that we are analyzing. Well, let's take a look at this particular teacher, Rupert, and deselect Mark. Oh my gosh. So Rupert actually teaches 4 classes in which red flag, Mark, the infected positive student, is in. Okay, 22 students are affected, that are in close proximity. And here is the list of all of the students that we need to implement the communications to their parents and guardians, and ultimately out to the school as it relates to, we understand where it was, exists, and we are implementing our plan. Again, we all know, even outside of COVID, that parents and guardians will react however they react, but we are implementing our plan as it relates to red, yellow, and green. And you successfully do that. You successfully mitigate risk as well as make it repeatable. That means it can be governed, and removing the exceptions to the process. So this is a very simple but effective way to say that we have the ability to load your clinical and student information system, make it readily visibility, and then actionable to your leadership team that are doing communications. All right. Well, what might that communications look like out there? So we need a way to take this data and turn it into a way to communicate. So this is where we would put communications plan in there. If you remember, that teacher taught a couple classes. And so in here, those classes that were associated with her teaching, but Mark wasn't in there, and those classes that Mark was in down here. And that information then could be communicated out to the teacher, the class, the campus or buildings in which we're in, and certainly ultimately out to the parents that need that information. Now, the level of communication is always tricky. I would argue and debate for more and get ready for the onslaught of questions coming in, but I think more communication is better, but nevertheless, that would be up to school leadership to decide. Now, we added something unique into this, which is the family score as it relates to their concern. So when our students are returning, we all know that there are different levels of concern, even within a family, even concerns with regards to their own personal health and well-being, their loved ones, maybe their parents or other family members, extended family that are living with them, or just overall their temperament that is one way or another. So one of the things we thought may be valuable in the communication is so we can sympathize with all of our constituents is understanding where they are. So what we've done right now is we've gone all the way down to a somewhat intimate level of detail where you might actually consider sending out a survey. How concerned are you about infectious respiratory diseases such as influenza? How concerned are you for yourself and your well-being? And we've got a series of roughly 10 questions that may allow us to calculate that and provide a higher level of understanding, sympathy, and ultimately communication and engagement as it relates to rolling out these plans. Now, what do these workflows look like? Because we have to implement it on a governed process. So in a governed process, we would argue that most current plans look something like this. Incredibly busy, but what I want you to focus on is this linchpin, the clinic, and what's happening to them as it relates to implementing this new revised plan. Their level of documentation, their support from leadership in the communication out there, the interfacing with the public health service is really, really important. As it relates to, boom, a child tests positive, boom, they're sent home, the parents' responsibility, the communication that we have with the Department of Health. What if there was a better way to do this? So we've simplified and made more efficient the plan. When a child has flu-like, sent home, communication with HIPAA-compliant communications, that parent is responsible for that appointment and follow-up before that child returns to campus. The online communication of that, not just to the parent, to the school, but the reminder, automated reminder from the school back to the parent. We're looking for that information from the test results, from the release that you will get from your doctor as it relates to learning to school, for school. That information also being electronically communicated back and forth with the Department of Health is key with regards to understanding and having them have the confidence in which your school can remain open, partially open, as it relates to dealing with the positive cases as it relates to COVID. Furthermore, understanding the KPIs that are required to keep those schools classes, and actually classroom up and running. So these are the actual mechanical things that we had here today to demonstrate and speak with you in these 30 minutes we've scheduled together. So 2 closing points. One, as it relates to recover, the student information system in and of itself has ways in which the standardized testing and scoring can be created. We would work with you on defining those new student level benchmarks and outliers as it relates to that, and then the ability to recover from that information. So let me just show you a brief example of what that would look like. So first off, remind you to get to here, just go to ipc-global.com to get to, move this control out of the way. If you guys want to see a wonderful example of public communication, one of our proud customers we're very proud of is the Philadelphia School, one of the largest in our nation. And inside of there, they're of course doing their communications, but under schools, you'll find this feature they've enabled called school profiles and data. And they actually push out the data as it relates to every one of their schools and their school performance. So I'm going to go ahead and drill down into where my child may go to School Central, in which they are communicating the school progress report and enrollment in those classes. We know our enrollment's going to be different. How different is it year over year, right? Student achievement within there. And this is where the benchmarking can be, because we have historical information, but it's also where by which we need to get back to these levels of performance in our indicators for our reading and math and science, etc., in there, so that ultimately they are career and college ready. And so this is yet another resource that you can have to consider how we can help you capture what your student level benchmark is, where the outliers are, and then tactics in which to achieve back to a proper level for each student. And moreover, enabling those students which will naturally recover, enabling them to be successful. Going to ipc-global.com is a great resource for you. Contacting me and our staff here out of our Atlanta, Philadelphia, and other offices we have, we will get you in touch with those solution architects and resources to help you to consider A, where you are, B, how this may help solidify your plans, confidently communicate those plans out to your constituents, and then effectively implement those plans with proper training and coordination of your staff and your leadership. So thank you so much for this time, and I look forward to following up with you personally. Take care.
Mark, thank you so much. Everyone, thank you for your time. As Mark indicated, you will see his email right here. And feel free to go to our website. And if you have any, like I said, if you have any questions or inquiries, please reach back out to us. We're more than happy to help and assist, provide guidance, and help your communities have a safe reopening. Thank you very much and have a great day.